Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone OZBEK, and tonight we have a very special guest. Her name is Dr. VELMA SCANTLEBURY. She has performed over 2,000 transplant surgeries. She has written over 86 peer-reviewed research articles, 10 monographs, and has sold over 1,200 copies of her book, Beyond Every Wall, Becoming the First Black Female Transplant Surgeon. So without further ado, please join me in welcoming Dr. VELMA SCANTLEBURY. Hello.
Good evening. How are you?
I'm doing well. Thank you so much for joining us tonight. I'm so excited to have you.
Thank you for having me.
Yes, absolutely. So let's start out with, tell us a little bit about who you are and what you do.
Well, I am a transplant surgeon, retired, I must say. I actually was born in Barbados, moved to Brooklyn, went on to college and medical school in New York City, then went on to University of Pittsburgh, where I completed my multi-organ transplant fellowship, and then went on to be a transplant surgeon. Have been doing this for 32 years and recently retired in October of 2020. So now I'm doing consulting and also teaching, and I'm a professor of surgery at Texas Christian University and Medical School, where I do specialty lectures as well as doing consulting lectures on my own.
Wow, that's pretty awesome. So Dr. SCANTLEBURY, what inspired you to become a transplant surgeon?
Well, let me say, I didn't know that I wanted to be a transplant surgeon because I wasn't exposed to it.
Yes.
What I did know was that I wanted to be a doctor, and I know that I wanted to take care of people. I wanted to be able to help others. The whole concept of being able to save lives and do something to help others. And initially I had I'd say family doctor. That was the person I saw, and I really was geared towards medicine because I love the idea of being autonomous, being my own boss, being able to do things the way I want, and being able to go, not have a whole lot of people telling me what to do. So that was early on. I was very stubborn and determined, but that seemed to fit well with what I wanted to do. And as I entered medical school, I was totally fascinated by the body. Gross anatomy, learning about the different parts of the body, what does what functions, and that intrigued me very much. And I was interested in surgery. And as a medical student, I met the first female surgeon, and she was a pediatric surgeon. And I actually wanted to be just like her. She was a dynamic woman. She was awesome, and she was so wonderful with her patients. And my goal in life was to become a pediatric surgeon, come back to Harlem Hospital, where I did my general surgery residency, and take over that program. That was my goal. That was my passion. And part of my criteria for part of the requirements for being a pediatric surgeon was that I needed to do research. And so my research turned out to be in transplant surgery, did kidney transplants in animals and looked at different drugs, went on to University of Pittsburgh, primarily to complete 2 years of research to become better qualified to become a pediatric surgeon, and then fell in love with transplant surgery and realized that I could do pediatric transplant surgery and be a general surgeon specializing in transplantation. So that's how I ended up in transplant. But just because I had never met anyone until I did my research, and as I was rotating as a medical student on transplant surgery, and then as an intern and resident at Harlem Hospital. And then I began to learn a little bit more about transplant. But my first love was for pediatric surgeries, and I found that I could merge the two during my training at University of Pittsburgh Transplant Center.
That's awesome. I'm going to ask you a question. How does it feel to be in the room knowing that someone's life is in your hands during this operation? Like, that has to be major pressure on you.
It actually was pretty scary. I mean, I had to learn the anticipation and the anxiety leading up to a case is really high, and getting there, my nerves are all turned over, and the idea that I have to remember what I'm doing, I have to be competent about my skills, and also about being able to guide those who I'm working with, whether it's medical students or residents who are helping with the case, being able to show them and help assist them in doing the right thing. And so you need a certain level of confidence to be able to say, yes, I know what they're doing, or to let them help you in terms of doing their portion, but also in being able to say, I got to get this right because this has to work. And this patient needs to stay alive. So during my training as a fellow, it was very scary, because then you to the extent that, yes, you're there, but you always had an attendant helping you or guiding you through, and then suddenly you're the attendant and this is your responsibility, and now you want to make sure that everything is right. So my first couple of cases as a new attendant, I didn't leave the hospital because I wanted to. I literally sat by the patient's bed, visited them every hour, made sure they were doing okay and they weren't going to die, and everything was doing well. So it was really nerve-wracking. But once you develop your confidence and you're pretty assured of your skill and your technique, then you begin to feel more and more at ease about saying, okay, I guess I can go home now and come back tomorrow. This will be there.
What are some contraindications that exist when determining, who can donate an organ versus who can receive an organ?
Well, generally we try to promote organ donation and saying that everyone should sign their organ donor card. You should sign up to be an organ donor. Don't eliminate yourself. Let the medical profession decide whether your organs are usable or not, because we've had people in their 80s still be able to use their liver for transplantation. If other organs are not as good, they may still be able to use certain things for tissues. So you could be a tissue donor or even a bone marrow donor. But sometimes even long bones, ligaments, skin, corneas, all those things are able to be donated, even if the solid organs such as your liver and kidneys are not in the best of shape. So we always say, don't eliminate yourself. Things that are absolute contraindications, if you've had a recent cancer or recent infection that hasn't been treated fully. So even in those cases, sometimes they can give you medications to eliminate to treat the infection. And so for people receiving organs, the same thing. Generally, we say sign up to be get on the list, find a living donor if you can. Be evaluated to see if you qualify for that transplant. Don't eliminate yourself, because in the process of being worked up for a transplant, we will discover so many things that we can fix that you may think may have eliminated you altogether. In the past, it was, well, if I had hepatitis, I couldn't get an organ. Well, we can treat that hepatitis now. And we can even use organs that have hepatitis, because we have medications to eliminate that hepatitis after transplant. Sometimes we discover people with cancers and we say, well, you may not be a candidate now, but once you have your cancer treated, once you go through a certain wait period, depending on whether it's 2 years or 5 years, to make sure that your cancer is completely gone, then you may be able to come back and still receive a transplant. So there are things that others may feel may negate them for being a donor as well as receiving a transplant. But we want everyone to feel like they should at least investigate, get yourself on the list. Many times we're fixing you to get you in better shape to get a transplant. You have a bad heart and we discover you have blockages in your heart. Well, we're going to send you to a cardiologist to make sure that you get the necessary treatment. You may need bypass surgery. You may need stents placed. But the goal is that we're going to try to improve your overall health to make you a better candidate for that transplant. So yeah, you may come to the table with many different issues, but we're going to fix you. We're going to help you get there.
I know some people are afraid of the myth that once you sign up to be an organ donor, then they're not going to save your life if an emergency happens.
Right. And that is, there's still a lot of that out there, in the sense that you need to understand that uh, the medical profession is, they have to be first, do no harm. The goal is to save your life. When someone has an injury that affects their brain, and generally for most people, brain death occurs because of the brain injury. Either they bled in their brain from a stroke, or they had an intracranial hemorrhage, or they had a trauma to the brain, car accident, motor vehicle accident. And so then the brain suffers because the brain has no room to swell within your skull, and the blood flow gets diminished because you have all this swelling of your brain. And so organ donation is not discussed until there's a neurologist saying that your injury is not recoverable. And at that point, then once they say, well, there's no return from here, either we pull the plug or you become an organ donor, then that information can be discussed with the family. Some donors will linger on, and the family may decide, we see this not having a positive outcome, and they're really willing to deal with that. And they may bring up the fact that, I don't see this, things look pretty ominous. And if he or she can't make it, we would want for them to become a donor. And in that case, we can start a little bit early to say, well, thank you for that. We'll do all the necessary blood tests and be pointed in that direction, but we're not going to actually do anything until that documentation occurs that says there's no longer any brain function. And unfortunately, many of the donors still look like they're breathing via the machine. The ventilator is causing them to breathe. So for the family, they look quite normal. They're connected to all these kind of drugs that continue to make their heart beat well or within reasonable measure. And so they see them as still being survivable. And that sometimes is hard for families to grasp. But when you say, look at this study that shows there's nothing going on in the brain, there's damage from the blood injury, or whether it's a CT scan or EEG that shows there's no activity in the brain or no blood flow to the brain, then gradually the signals to the rest of the body is only a matter of days before they become no more signals. And so the goal is to be able to say, while the heart and the other organs are still continuing to function with the aid of the machine, then we can still be able to have organ donation occur before everything goes downhill.
And what is a typical time frame that you have to get one organ from one body into the next before you can't use it anymore?
Well, generally, once we have someone who is a donor and the family has agreed to proceed with organ donation, and families can often decide what they want removed. There's some people who say, I don't want you to touch his heart, but you can have the liver and the kidneys and anything in the abdomen. And so if they're say, you can have or donate anything that's possible to donate, then it's a matter of coordinating to have all the teams in one place at the same time. And so while I may know, 6 o'clock this evening, the family decide that they want to proceed with organ donation, it may take until to place those organs and to know where they're going, and also to have those surgeons come to recover the organs may take about 12 hours. So somewhere in the middle of the night before the OR gets busy in the morning, we may have the heart team coming from New York to rescue the heart. We may have the lung team coming from Pennsylvania to get the lungs. We may have the liver team coming from North Carolina to get the liver, and the kidneys may go locally, or one kidney may go with one of the organs. So you have to coordinate all those teams to be able to have them there and ready to take the organs that they want for their specific patients. And the timing most of the time is geared to the recipient of the heart, because the heart cannot be removed. It has to be out of the body and be in the person receiving that heart within 4 hours. So generally, they're flying no more than 2 hours away because you want to be able to have ground time, get to the institution, and then be able to place the heart in. So there's a limited amount of travel time. But as far as everything else, the lungs can be allocated, within a little bit more time. Yeah, but generally, you want to get them in sooner or later. The liver can generally go across the country, and kidneys can last the longest out of the body. So I can go as much as 36 to 40 hours before I can need to put the kidney. So in other words, I can bring a kidney from Seattle, Washington, all the way to the East Coast to place it because it was a perfect match, or something that was asked really, really well, that would be worth it coming across the whole country to give it to one person. But generally, you want to allocate your donation to within your network and your local area, and then you spread out. But then there are those people who may be a perfect match, and may be able to say, okay, I am here in Philadelphia, but this kidney matches perfectly to someone in Florida, so we're going to fly that kidney down to them.
Wow. What is the longest surgery you've had to perform? How long did it last?
Back when I was a fellow, we used to have some very long cases because patients were very complicated in Pittsburgh. And I have to say, probably the longest one was about 16 hours.
Oh,
that was a very, very complicated liver transplant.
Oh my God. How do you stand up for 16 hours? No bathroom breaks?
You do take breaks. You do take
okay.
breaks. You do take breaks. You often break, and someone comes in and help you out while you go, get something to eat, and then you come back. And oftentimes there are teams that would help in different stages so that you come back and finish up. They'll give you a break. And there are other times they're waiting for the organ or the patient to catch up. If you say you need to give blood, or the things that occur, you waiting to see if the organ is going to work well. But that was a very, very, very complicated case. It took a long time to take the old liver out, and it was very complicated. That was probably the good 6 hours just to be able to, because the liver was very scarred and stuck to everything. And so, and then but once you get through that, generally placing it and generally waiting to see and fixing things afterwards is most of the time you're sort of dealing with bleeding and trying to correct the bleeding and trying to figure out how to make the new organ work.
Yeah. Now you're from Barbados.
That's
So what was your childhood like growing up?
Well, we were in that space. We had a large family. I had 4 brothers and 2 sisters. And so it certainly was not a privileged childhood, but we didn't know what we didn't have here from that standpoint.
Right.
We were a happy family. My parents, we were all God-fearing, went to church, had little means, but what we had, we were able to share. My dad was a policeman. My mom worked at home, and basically, education was a priority in Barbados in terms of going to school, making sure you go to secondary school, going on to higher education was very, very important. And that was one of the focuses of my mom in terms of coming to the United States. In the earlier days before we became independent, my older brothers went on to England to further their education, as we were a British colony during that time. And once we became independent, opportunities became available to come to the United States. And my mom took advantage of that, and we moved to Brooklyn. And from there on, I went to high school through to college in Brooklyn and went on to medical school. So yeah, it was a different environment altogether growing up in Barbados and going to high school here in Brooklyn. Quite shocking.
Now, in your book, you talk about that you had a few challenges because your skin was a little bit darker than most families in the area.
Yes.
How would you say that kind of added to your success of becoming a transplant surgeon?
Well, I think, one of the issues that we sometimes have to deal with within our own uh, ethnicity and group is certainly for us growing up in Barbados, it's more about colorism in terms of, yes, those team who were lighter seem to have a great advantage in terms of even the schools they went to versus those who were dark. And but coming to this country, that the extent of racism was probably an eye opener for me coming to Brooklyn and going to school, and then seeing the barriers that I had to face because of just my color and my skin, in terms of the opportunities being not the same for those who were even in my school in Brooklyn, which was mixed, but certainly uh, favored the white students over the dark students, certainly from that standpoint. But for me, my ambition, my drive, and my determination to become to go to medical school and to become a doctor was foremost in my thought. I mean, that was what I sought after, and I made sure that I stayed true to my dream, and I didn't allow the negativity. Initially, as you read in my book, I talk about even the high school guidance counselor telling me I didn't have what it took to become to go to medical school, to become a doctor, and that I should just to go to college. I didn't have what it takes to go to college, and so she just advised me to get a job, and maybe I can go to night school. And I was fortunate enough to have the positivity and the reinforcement of my parents, who said, "No way, you're going to college." And I only applied to 2 colleges. That's the lack of confidence that I had, or the fact that I was like, I don't know if I want to waste money because you're telling me I'm not going to make a good college student, and I should probably think about it later on. But I got a full ride to college with that first application, and to me, that was telling me that God knew I had something in me, and that I had something to savor, and that I was going to be okay. And so I went on to college and did well in college. And again, the second obstacle for me was applying to medical school and having my own college tell me that the reason I got in was because Columbia University needed token blacks. You know,
Mhm.
and I wouldn't have been so fortunate had they not been looking for people of color, as opposed to saying, well, you're very smart, and congratulations, we're proud of you for getting into medical school from this institution. So though sometimes that negativity can keep us back, and just imagine if I didn't wasn't in a situation where my parents said, you going to college, there's no ifs, ands, or buts about it. And we're going to fill out some applications without the help, even though they're not going to help me. And so that's the kind of thing that we need to reinforce to our young people today, in terms of being able to point them in the right direction, give them that encouragement, often provide them with that opportunity or mentorship, even in terms of trying to lift them up and place them in programs that they're going to make them more accessible to have the materials and the capability of applying to college, because there's a lot of negativity out there.
Yes. And one of the doctors that gave you a hard time in school, well, I guess during your residency, is it pronounced Dr. Starzl?
Yeah, yeah.
What was it like being in the operating room with him yelling and screaming at you, like as if you were incompetent?
Oh yeah. That to me it was difficult because I had just come from being a chief resident. When you are in charge, you're in charge of the residents, you're telling people what to do, and you have that leadership skill, and you go off into your fellowship, and suddenly you're the lowest person on the totem pole. And you make you feel that big, and that your knowledge and what you brought to the table was absolutely nothing. Questioning whether or not, where'd you go to medical school? But that intimidation, in some sense, allowed me in the beginning to say, I am just not going to let him beat me down.
Yeah.
Sometimes I try to ignore him. You try to sing in my head to be distracted from the negative things, but in the end, I realized it wasn't just me. It was all of us. He was really that way with, and we really then ended up with, in some ways, very little self-esteem because he would beat us to death. But it taught us how to be good surgeons. And in the end, it made us really look at our capabilities and brought out the best in us, and that it challenged us to say, if you're going to scrub with me or do this case with me, you better know what you're doing. And so that making sure you come to the table prepared 100% or 120% as a woman. I had to have that upper edge.
Yes.
To make sure I was just as good as the rest at the table. So preparation was key, that knowledge, and trying to hold on to that confidence.
How did your life change when you met Dr. Barbara Barlow, who was the first surgical attending there?
Yes, absolutely. She was a force to be reckoned with. I always tell others that she had a skin condition at that time. She was probably the palest white woman I've ever seen. But, she was fantastic. She was great with her kids. She would carry them when she operated with them. She would take them out the cribs and she would carry them in her hand to the operating room. And she was so fantastic. I wanted to be just like her. I think she used to operate with her little pinkies in the air because the kids were so small, the little babies and stuff. And so she was fantastic. And she also was a trauma surgeon. And she was one of the surgeon who advocated in that time for window guards, because so many kids in Harlem were falling out of windows during that time. And she advocated for the city to demand that there be guards, window guards placed to keep kids from falling out as they lean over the windows. But I wanted to be just like her. She was my model of success, how to take care of patients, had great bedside manner, great outcomes, a community activist. And so in my mind, this was who I was going to be, just like her.
What was one thing she said to you during that time that you'll kind of keep with you forever? Was it one lesson that she taught you?
The one thing she taught me a couple of things, but one of the things that impressed me a lot in the way she conducted herself was really about your doctor-patient relationship. Always don't talk down to your patients. Take a seat is what she would do. Say, grab a chair, talk to them on eye level, talk to the family on eye level, and always treat them with respect. And that was one thing that I carried with me, and that patients appreciate that in terms of seeing them as human beings and not looking down on them as saying, I'm the doctor, you're just a patient, you have to listen to me, but really having that respect as a physician, as a surgeon, so that they're comfortable and they are assured that what you're doing is in the best interest of their loved one.
Yes, absolutely.
Yeah.
You're also a member of Delta Sigma Theta.
Yes.
I know I have some friends out there watching. How did you feel when you got the call to be an honorary member of that sorority?
I was totally blindsided by that. I was in Alabama at the time, in Mobile, Alabama. I was working the only surgeon at the University of South Alabama. And so I got the letter, but didn't think through what it meant or any of that. While I was trying to figure out how am I going to get from Mobile, Alabama to Philadelphia, provide coverage for my patients, be able to sneak away to this conference. It wasn't easy to get to because, you couldn't fly out of Alabama without changing someplace. Mm-hmm. And so I arrived in Philadelphia, knowing, you had the whole drill, we're white and all this stuff. And you have to stand outside. This was at the convention center. And I'm in this white robe and I'm like, where's all the others? And said, well, it's just you. It's just me. And my time comes and the door opens up, and all I could see is this whole convention center full of Black women, and there are video screens all in the up the roof of the convention center, and I had to walk down this red carpet. I mean, I was just thinking, oh my gosh, I can't believe they did this to me all alone. And so, I mean, I had this grin on my face, trying to be, you know, trying to greet everyone, and all the applause and stuff. And it seemed like it was the longest walk ever. I'm thinking, when is this going to end? So it was pretty phenomenal. I can still see it in my head right now. Then I'm sitting there on stage with all these celebrities, and it was like, I can't believe these are the people I'm sitting up here with. So it was awesome. It was awesome.
That sounds awesome. And what year was that?
This was 2006.
Oh, nice. That's
Yeah.
right.
Yeah, definitely. It was definitely.
Now, let's talk about the love of your life. You were introduced to him kind of like on a blind date, where you're like, nowadays we could just Google somebody when we want to know information.
Yeah, now you can. Yeah, back then I wouldn't even think about Google. Yeah, I wasn't even thinking about Google. Yes, I was. It was a blind date by one of a medical student at the time, and she was from Louisiana. And yes, she met my husband Harvey, and he was from North Carolina, but he was working in Louisiana. So he was on the sabbatical year at University of Pittsburgh, and so he still had his Louisiana license plates. And so he saw this student, and they met, and they sort of became like a daughter to him. And she called him up one day and said, I found you a wife. And she called me up and said, how do you like dating older men? I'm like, well, how much older? She said, well, he's a little older. Yeah, because at that time she was 25. What does she know? Older men in their 30s. And so she put us on a three-way phone call and made us talk to each other. She said, I'm not getting off this line until you two make a date to see each other. And so, yeah, we did. And so we went out to dinner probably every night. Then I was off for probably a good 3 months straight. Yeah.
That is so awesome.
Yeah,
that's such a cool story.
Yeah.
Another thing I want to discuss is one day you were out shopping, what you call shopping while Black, and you were almost arrested for a crime you did not commit.
Yes.
So tell us a little bit about that.
Yes, I actually was shopping with the same medical student who had introduced us, and I was pregnant, and I remember waiting. I was trying to think, my back was hurting, so I said, let's go for a walk. She was visiting, and I live near a main shopping area street. And so we were just walking. I think I just took my keys, and I didn't even have any ID on me. Wasn't thinking about buying anything. I was just going for a walk, and we were window shopping, and just sort of went into this children's store, and came out, looked around, came out, and was walking down the block. It was a one-way street, so I got to about 2 blocks up, and was in the back of another store where when these cops came in and said, ma'am, we need to talk to you. And I said, well, what about? And she says, well, I need you to step outside the store. And so I keep saying, what about? She said, we'll tell you when you're outside the store. So we went outside the store, and she said, well, you were accused of shoplifting at the other children's store you were just in. And the owner identified you too as having stolen some items. And I said, I don't even have a bag. Where am I supposed to have put these items? I said, this is all belly. Would you like to see? And I lifted my shirt and said, where am I supposedly hiding these items? And she's the female cop, and says, well, we have to take you back to the store to identify, to see whether you are the person that the owner identified. And she said, would you like to get in the van? I was like, no, I'm not getting in your van. I said, I will walk back down the street to the store. It was a one way. She wanted to ride me around the block to the other side. And I know, so I said, no, you can walk with me, but I'll walk on back to the store. And I did. And I was totally embarrassed because by now everyone is staring at me. I had no identification. And I got back to the store. We went to the door of the store and on the steps, and the owner came out and he just looked at us and said, no, it's not them, and walked back in. No, sorry, ma'am, we made a mistake, nothing. And I was just totally floored and embarrassed. I'm like, that's it? You have accused me of shoplifting. Now you don't even offer an apology, and you just turn around and just walk away. Like, this is nothing to you. Now that you've embarrassed me here in the street in this neighborhood. So yeah, it was pretty embarrassing. I was floored. I was totally embarrassed. That was absolutely a nightmare. I mean, I just kept remembering that. And I went home shaking. I was like, let me just go home. I have to go sit down. So yeah, that was quite embarrassing. But it happens to so many of us.
Yes, definitely. And it's so crazy because what if he had come out and said, yes, those are the
Yep.
girls? Your life would have just changed drastically just from him,
Yep.
saying yes to that.
Yeah, and T kept saying, well, perhaps you have them under your clothes. I'm like, I do not have anything under my clothes. How could I stuff them under my stomach here? I'm 8.5 months pregnant.
Right.
Yeah, so.
I think I would have been livid.
Yeah, I was. I mean, I thought I was going to have that baby right then and there. So let me go home. I am just shaking because will not let this anger destroy me. Yep, just totally walked away. No apology, nothing. Yeah.
So one of the things you mentioned was during your fellowship, you suffered from a little bit of depression and self-esteem issues.
Yes.
What do you attribute to that? What do you think caused for that to
Well,
happen?
I think certainly, oftentimes we don't have a cause for depression, but sometimes there are depressions that are situational. And one of the things that, as within the Black communities, is that mental health is just something we don't discuss and that we don't want to own up to because it's embarrassing. And other people think that if you have a mental illness, then you need to see a psychiatrist or you belong somewhere. And even within the Caribbean community, it's a stigma. And so you try to tell yourself that this isn't it. As folks would say, you just need to pull yourself out of it, quote unquote, was always the term family members would say. And I think for me, part of it also was, yes, situational, dealing with young kids, trying to balance a career where there was all this racism and sexism in itself, trying to prove that I was competent, trying to maintain my confidence and having very little self-esteem, feeling like I didn't belong, what they call trying to figure out, did I fit in? Am I in the right place? I'm being treated like you're not in the right place. And that imposter syndrome, feeling like not that I would say it was reversed because I knew I was competent. I knew I had what it takes, but others didn't see me the way I saw myself, or didn't view me that way because of the negativity either of my patients or those I worked with, in terms of being shafted with the cases where I'm working weekends and not having enough time at home. And so part of that just got to me and added to my stress. And I found myself spiraling into this depression. And initially, that the whole stigma of is, what can I do? Can I tell? So I don't want to tell anyone because of that stigma of depression. And it wasn't until I was scrubbed with one of my another surgeon from South America, and he was talking about how working there sometimes gets you down. He was talking about the fact that he had to take Prozac. And he says, yeah, I have to take my Prozac every day. And that was I'm like, you take Prozac? He's like, yeah, I'd be crazy if I didn't take my Prozac. I just said, this place drives me insane, but I have to do it because otherwise I wouldn't be able to do what I want to do every day. And that to me was like affirmation that it's okay. It was okay for me to be able to say, now I need help. Let me find that help, whether it's medication or what, to be able to help me to live to that place where I can feel better about myself. And even after I started taking it, I would sort of try to deny uh, that I really needed it for that. And oftentimes I would say, well, my gynecologist gave it to me for hot flashes or for this thing or for that thing, because I didn't want to admit to myself that, yes, I had to deal with this depression. But once I was on the medication and felt better about myself, I was able to move on. I was able to really do the things that I really wanted to do, and was able to uh, build my self-esteem up. And that was important. It pulled me out of that dungeon I was in, to be able to say, if this place isn't good enough for me or not treating me, maybe it's time to move on. And sometimes as Black women, that's a hard step for us to be able to take, to get out of our comfort zone and even begin to see that treatment, or that you're being held back in a place where you could probably flourish and do better. But oftentimes it's hard for us to take that next step.
Yeah,
Yep.
definitely. And one of your quotes, you said, I was an interloper. I was in, but not apart. What did you
Absolutely.
mean by that?
Well, we started out with 3 women out of the 10 of us who were trained as fellows, and one left after a few months of training. And so it was less myself and another female who was a Jewish white female. And so there were other Jewish attendants that she gravitated to, and the other 7 fellows all got together. Either some of the attendants invited them over for dinner, or the pool parties, or there were events that occurred, and I was never invited. Whether it was that they felt uncomfortable. So even though I was part of the whole arena, the things that happened around me, I wasn't included in those gatherings, but because they didn't feel like I wanted to come, or I didn't fit in. And so, as when I mentioned that to some of my colleagues years later, as we have a Facebook group, and they would post pictures of all the activities that went on, and you realize I'm not in any of those. From that, it goes, well, that's interesting. Oh, I didn't realize that. Well, what do you mean? Why you wrote that in your book? I said, did you ever thought to invite me? Yeah. And so from that standpoint, I had to find my own support system. I had to find, whether it was my sisters, whether it was the nurses, other Black organizations, the church members that I could reach out to, in order to find that support, because my family was in New York and my husband's family was in North Carolina. And even though it seemed like it wasn't that far away, that was still a hike for others to come to even visit us, or be able to lend their support physically.
Yeah. And one thing you said that resonated with me was when you mentioned about your facial expressions, and how people, automatically assume like, oh, you're angry, or you don't like something. It seems like sometimes as Black women, we have to walk in the room and smile for people to even think that we are approachable.
Absolutely.
Or they label us as having, a bad attitude.
Angry face. I having that. Yeah. Why are you so angry? Even my husband says his some of his colleagues would say, your wife always looks so angry. I have other things on my mind. I maybe not be thinking about you, but yeah.
Right.
You feel like you have to have this smile on your face to make other people comfortable all the time. And I remember one of the residents who I was mentoring at the time, and she was I used to call her the ever-ready battery. She would always be bouncy and smiling and bubbly and everything. And in one of her evaluations, on the opposite end, one of her white attendants wrote about how she was pathologically happy all the time, and no one could be that bubbly and on that level 100% of the time. So something had to be wrong with her. So I want to say, now what do you want us to be?
Right.
You cannot be bubbly and happy all the time. And if you don't have a smile on your face, then you're angry.
Right.
So, yeah.
I know it's like either you're angry, or, they take that smile as like weakness, so they kind of take your kindness as a weakness. So it's like sometimes it feels like you just cannot win.
Absolutely. One of my partners would say, even before I said something, he would be like, You have that look on your face. Yeah, like what look?
So, since you retired in October, what have you been doing?
My plate has been full. Actually, I've been doing more than I intended to do. As people discover I'm retired and everyone wants me to be involved with their organization. But I retired at a time when we were in the midst of COVID, and so getting the as we move towards the vaccination, uh, education for our people of color and getting folks to understand the importance of being vaccinated became one of the platforms that I sort of undertook and began advocating and reaching out to figure out, one, how can we get more people of color to get vaccinated and to relieve their fears, have the open discussions with many of the different organizations, been working with the National Coalition of 100 Black Women and their platform to begin to educate communities, working with my linked sister in terms of doing that, working with the Deltas, with women over 65, educating them, trying to figure out how do you bring equity to our elderly and our seniors who needs to get vaccinated, and to make sure that our people of color don't get left out in this whole vaccination process, as we become those who are most often subject to the mortality and the death rates and the comorbidities of our disease processes, being those who end up with COVID and dying from COVID. So that has been a high on my platform. And actually also working with our sister group in Philadelphia, Black Doctors COVID Coalition, to help vaccinate the residents of Philadelphia as well. I'm also teaching and giving lectures at Texas Christian University and the medical school there, have some lectures on schedule, and also doing some grand rounds for various institutions and different organizations on, especially on, also on kidney transplantation, organ donation, health equities, very big topics these days.
Awesome. You have been really busy.
Yeah, I've been sitting in this chair too long.
So, do you have any closing remarks for the viewers out there tonight?
I think it's important. What I would like to get across is, one, we are certainly in this pandemic, but there's hope for us on the horizon, and it really centers around getting vaccinated. And for any of you who are out there who have fears about the vaccine and the fact that you're scared or you don't know what's in it, or you're not willing to take the chance, my question to you is, are you willing to get COVID and perhaps die from COVID? Because the mortality and the consequences of getting COVID certainly outweigh the risk from this vaccine. This vaccine offers protection from keeping you from dying, keeping you from getting hospitalized, and providing you with the necessary immunity to stay just maybe minimally ill if you get COVID. It's not going to keep you from getting COVID. It's just going to build your defenses so that you are more equipped to be able to fight off a COVID infection and not die from it or not be debilitated from it, because it can have lasting consequences, both in terms of cognitive ability, in terms of your thinking. It can affect kidney disease, it can affect liver function, and it can also cause blood clots and cause loss of limbs. So there's so many different and chronic respiratory problems long term. So those are things you have to think about. So, and if not you, helps the others, if in your community, in your family, help get the older family members vaccinated. Take someone to get vaccinated with you. And remember that there are many of us as people of color who are dying from COVID. And for us to get through this, we need to have all people vaccinated, as many as possible, at least 80%, if we're going to really combat this and stop people from dying.
And Dr. Scantlebury, if people choose not to get the vaccine, what are some ways that they can strengthen their immune system at home?
Well, I don't know, people say certainly make sure you take your vitamin D and your vitamin C and zinc. Those are things that are said to help build your immune system. But COVID does not discriminate. Young, old, healthy, frail, black, blue, green, orange, it doesn't matter. It depends on, you may have a perfectly healthy body and still may be subjected to COVID because you may get a blood clot and die. And so that's the bottom line, is that there's not a recipe out there that can guarantee you anything. You just have to make sure that you are healthy.
Oh my God, it's my dog.
And even then, so get vaccinated. You get immunity of your own body is what you need. So I think that's very, very important to understand, is that you can still take all these extra stuff to boost your immune system, but in the end, having your body make those antibodies to protect. We take the flu vaccine to keep us from getting the flu. We get vaccinated from other things to keep ourselves from getting polio and from getting tetanus and all these other things. And we don't think twice about what's in them. So this is not that different. It's a new technology, but we're up to 485,000 people who have died in this country from COVID, and over 2.5 million people have contracted COVID. We have 2 million people have gotten the vaccine, and so far only one reported death that we're not even sure if it's associated with the vaccine or not. So the odds are certainly not the same.
Well, thank you so much for coming on the show tonight, and I hope that you viewers out there got some amazing information. If you have not done so already, be sure to go to her website and purchase her book, Beyond Every Wall, Becoming the First Black Female Transplant Surgeon. And this is a website that you can purchase if you would like to book her for speaking events or anything that you have coming up. You can find her information on this website as well. Thank you so much, and I hope you guys have a blessed evening.
Thank you. Thank you. Good night.